I am looking forward to seeing you in Scottsdale and having the opportunity to tell you about research that is aimed at improving the way we evaluate hearing abilities in infants. We are all aware of the positive impact that early detection of hearing loss has had on the language, speech, literacy, and academic achievement of infants and children with hearing loss. This was made possible by the use of electrophysiologic methods of evaluation, primarily the auditory brainstem response. While the auditory brainstem response is still central to assessment methods in infants, the brainwaves or evoked responses from the auditory areas of the cortex provide additional information about how the infant's ear and brain are processing sound. Cortical responses can be obtained from the infant using tones, words, syllables, or individual speech sounds. Comparisons can be made between listening in quiet or in noise, or when using a hearing aid or cochlear implant. These methods are proving useful not only for initial assessment, but also for validating the fitting of a hearing device. Findings from my lab demonstrate that cortical responses to speech sounds can be measured in infants as young as 4 months of age. Infants can be tested while awake. Cortical brainwave responses are evident for speech sounds that are presented at levels comparable to thresholds established by the auditory brainstem response. These cortical responses are present, like the ABR responses, even when the infant is unable to provide a reliable behavioral response. We are also using contrasting vowel sounds to test whether the infant's ear and brain have the capacity to discriminate between them. We find that the cortical responses to these contrasts can be used to indicate whether amplification is not only loud enough, but whether the signal being provided is clear enough for the ear and brain to discriminate between them. Infants can be tested while awake, but not actively attending to the sound. Recently published data from the United Kingdom and from Australia indicate that the adoption of these methods can lower the age of hearing aid fitting or cochlear implant surgery. This is expected to result in greater and earlier gains in hearing and speech development for infants with hearing loss.